And this is ancient, and I don't know about you, but something that is thousands and thousands of years old must hold some
Yeah,
weight as far
agreed.
as if its effectiveness. So I always start with that. Next, we go through the history of the pet. And with acupuncture, we are looking at the whole entire pet. So I always will tell owners, hey, I want you to tell me everything from day one. The day you got them, I want to know everything about them. What do they like? What do they not like? How do they get along with other animals? How do they get along with other people? And when I get a comprehensive history like that, people are typically very impressed with the details because all of those details really determines how I'm going to treat that pet.
From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. In this episode, we're joined by Dr. Arielle Walton, a veterinarian, certified veterinary acupuncturist, and founder of Paws Acupuncture of Nashville, a mobile clinic dedicated to bringing integrative care directly to pets and their parents. With her expertise, we'll cover what acupuncture looks like for pets, what it can help treat, and what pet parents should know before scheduling a session. Dr. Arielle, it's so nice to have you here. Acupuncture is such I would say a not so thought of thing when it comes to dogs. I know I've had acupuncture done. So tell me, what kind of training or certification does a pet acupuncturist need before they're able to practice?
So veterinarian needs to be one, a licensed veterinarian.
Okay.
Two, they need to obtain what we call a CVA, a certified veterinarian acupuncturist certification. And that involves additional schooling. It's not what we learn in vet school of any sort. They need to go on to do coursework, certification exams, and they also need clinical experience as well too.
Gotcha. And what, in your experience, what are the common issues that you're typically treating acupuncture for?
Mobility is going to be number one.
Okay.
Joint issues, neurologic issues as well too, such as intervertebral disc disease, where pets will go paralyzed. I would say that's my number one patient, is a patient that has any type of musculoskeletal issues.
Okay. And what is the science behind that?
So when I am placing a needle, I'm placing a needle in a specific spot, what we call an acupuncture point spot. And so when I place a needle into an acupuncture point, what we're doing is stimulating the nervous system pathway. And by doing that, that signal is going to go up through the spinal cord to the brain. There we are going to release certain chemicals, natural chemicals. This can be serotonin, this can be endorphins, this can lower cortisol levels. Also, when I'm placing a needle, it is going to help dilate a blood vessel in that particular area, which is going to improve circulation. And so that circulation is going to bring additional oxygen to that specific area, and it's also going to remove waste products as well too. So that's kind of the science behind it. And it is an ancient therapy, but we have, in our modern science world, we have evidence now that shows on brain scans and hormone levels that this is a truly effective therapy.
I love it. Now, walk me through what that process looks like from like intake for you and how you actually go about. I would say I would love to know how you introduce that to people, especially somebody who's skeptical, and kind of convince them to do that, as well as the actual process in and of itself, the physical process of inserting needles and whatnot.
Yeah, so I always start with the science behind it, because some people it can be mysterious to most people. So I just start with the science and show that there is evidence. There's tons of evidence out there, tons of articles and case studies that they've done, not only in animals but in humans as well too. And this is ancient, and I don't know about you, but something that is thousands and thousands of years old must hold some weight as far as if its effectiveness. So I always start with that. Next, we go through the history of the pet. And with acupuncture, we are looking at the whole entire pet. So I always will tell owners, hey, I want you to tell me everything from day one. The day you got them, I want to know everything about them. What do they like? What do they not like? How do they get along with other animals? How do they get along with other people? And when I get a comprehensive history like that, people are typically very impressed with the details because all of those details really determines how I'm going to treat that pet. And that's totally different than practicing in the clinic. Unfortunately, we don't sit and ask those really detailed questions. And so just that approach alone can opens up opens up people to wanting to, okay, invest in that particular therapy.
Okay. Do you think, because when you were saying that, and earlier you mentioned like neurological and nervous system.
Mm-hmm.
So do you, in your experience, is there a situation where, let's say, a patient comes in and they are on something like Prozac or Trazodone, that you may suggest that you could potentially take them off of that, or you
Mm-hmm.
would use acupuncture as a substitute to make the situation better, or the anxiety or
Right.
stress that the dog is experiencing?
Yeah, so we kind of take approach where we introduce acupuncture at the same time reducing those medications, and just
Okay.
kind of taking it in a stepwise fashion,
Yeah.
just slowly tapering those medications down to a dose that is effective for the pet. And
Okay.
in some cases, the pet never comes off the medication, but we do reduce the dose, which also reduces the side effects, which typically are sedative type side
Yep.
effects. So we can make a difference there.
Do you get excited when you're able to offer that to somebody?
Oh,
Like, you have this thing that they probably haven't heard of yet, and I'm sure you're just like, hey, I have something. Does it make you feel hopeful, or when you share that
yes.
information?
It makes me feel like I have found my purpose. Like,
I love that.
it really makes me feel intentional with how I care for
Yep.
animals by bringing in something that is not everybody's first thought.
Yeah.
And it really excites me when I'm just able to educate an owner, because I know that that owner is going to go tell the next owner, who will go tell the next owner.
Yep.
So I take pride in being able to introduce a therapy, and I love when we can see real big results,
Yep.
because that is what gets people
Yeah.
talking and recommending
Yeah.
it.
The results speak for themselves,
Right.
for sure. Any situations where you would not recommend acupuncture?
Yeah, so I would say one would be the pet itself, as far as maybe a fear aggressive pet,
Okay.
or a pet that we just cannot necessarily handle them in a safe way.
Okay.
They may not necessarily be a candidate for acupuncture, and I speak of the traditional
Yeah.
acupuncture. I always say there's always a way that we can help them. It just may not be in a traditional sense with needles. But I would say those are the pets that we try to find other modalities for them rather than the acupuncture
Okay.
needle. Yeah.
Yeah, I'm glad you mentioned that, because my first thought when I heard acupuncture is, I mean, and maybe it's just because of like my scope of practice and my
Mm-hmm.
field, but I deal with a lot of like nervous, fear-reactive dogs
Mm-hmm.
who have difficulty being handled by strangers, and in some cases even the owner themselves.
Right.
So how do you navigate through that? Because my first thought again, it would be, how are you going to take a dog who doesn't like to be handled, let alone, I mean, granted, you have a mobile clinic, so
Mm-hmm.
it's a little bit different,
Mm-hmm.
but even still, going into your mobile clinic, it's a new environment for them. You have to now like potentially lay them down or have them stay still.
Right.
What does that look like, and how difficult can it be?
Yeah, so first thing is just gaining their trust. That's number one, and I always tell owners that I take a fear-free approach when I am doing acupuncture. I hope to be that doctor one day that can place one needle and heal all the world's problems.
Yeah.
Not there yet, but I determine the amount of needles based on the pet's response.
Okay.
If they have decided that, hey, 5 needles is your limit for today, then I'm going to pick my best 5 spots for them. But it's definitely gaining their trust. I also use a lot of calming techniques. I'll use essential oils to help calm them down. I'll use some laser therapy also to calm them down as well. I am big on treats and just kind of bribing them
Yeah.
as well too, to sit still and rest. And then there are some pets that they don't want to sit still. We place the needles, we count them, we use colorful needles. They may do some little laps around the house of some sort, and that's what keeps them calm. And we manage that just fine. So it
Okay.
is a very customized therapy, just depending on the pet.
I see. So they don't have to necessarily be still the entire time.
They don't necessarily have to be still. I prefer them to be
Yeah.
still, because we can introduce other therapies, other acupuncture therapies. But if they're a pet that, hey, it's either they get to take a couple laps or they get no acupuncture,
I see.
I'll take my chances in letting them do a couple laps.
When I was looking into acupuncture, there's needles and lasers.
Yeah.
Can you walk us through the differences and like when you would choose one over the other?
Yeah, so both are great at just reducing inflammation. I describe laser therapy as high intensity light that is targeting damaged cells it is basically handing them a Red Bull and saying, I need you to do your job, but on Red Bull mode.
I see.
Okay. Acupuncture is doing that, but a lot of other things as well too.
Okay.
When we're doing acupuncture, yes, we're using that needle. Most common question is, does it hurt? It's a needle. It's not a cotton ball.
Yeah.
So it can be a little uncomfortable, but it is a very small, thin needle. There are
Okay.
some pets who they just do not tolerate that whatsoever.
Yeah.
And so what I will use instead is the laser, and I will use an acupuncture attachment, which is basically just a narrow cone that will be able to pinpoint that particular acupuncture spot.
Okay.
So not only are they getting the benefit of the laser, but we're also stimulating that acupuncture point that will go up to that nervous system and regulate it.
Okay.
Yeah.
Do dogs and cats respond differently?
Oh, yes. Yes and no. So dogs, for the most part, because it's pretty easy to gain a dog's trust, they accept acupuncture very well.
Okay.
Their effects are very good. But when it comes to cats, I would say they probably have the most dramatic response to acupuncture. Yeah, they really respond to it. And I used to tell owners, I had a track record. I'm like, it's 50-50. Either your cat's gonna love it or your cat's gonna absolutely hate it. I had a couple patients, a sibling household, about a month ago, who both of them did well. So my ratio my track rate as far as 50-50 was kind of dispelled there. But cats, again, gaining their trust, moving slowly with them. They are special creatures, so I can't go in like a dog. I do schedule my appointments where I'm not coming from a dog household going into a cat household.
Okay.
I try to put that cat at the first of the
Smart.
day. Again, to just kind of keep the stress level down, because it is new. Dogs are going to be more curious and interested in what you're doing, while cats are going to be a little bit more apprehensive to what you're doing when it comes to needles.
I love the thought process though, because I don't think a lot of people would even think about coming from a dog house and then going into a cat house and what that can mean for the cat.
It's quite disrespectful.
Yeah. I love how you said it, because you know it is for the cat too.
Yeah, exactly.
That's funny. Wow, that's hilarious. When someone gets acupuncture for their pet, how soon can they see results? Positive results in what you've offered them?
It depends. It depends on the condition. A lot of times acupuncture is cumulative. So each session builds on the previous session.
Okay.
So it does take several sessions to see effects. Anywhere from 4 to 6 sessions is usually where I start at.
Okay.
And then after that, we kind of go on to a maintenance routine. But there are some patients where we see results day one. They got up nice and spry in the morning. There's some patients where it takes time, and I usually say, hey, it took us about 5 years to get to this point. We're not going to heal it in one day.
Yeah.
So it just, again, it takes some time, but it's the subtle changes that I ask owners to look for. And when I'm doing my initial evaluation, I have the owners grade their mobility, grade their pain level.
Okay.
And then we reevaluate that when we get into our 4 to 6 sessions. And the owners, they don't always remember what they graded, a month or so ago. So when I remind them, like, hey, you had them at a higher grade as far as pain, that's kind of where it kind of sits in. But I really encourage owners to look for subtle changes, because oftentimes we're not going to see huge miraculous changes, but over time those subtle changes add up to be a bigger difference in the pet.
I love that approach and mentality. When I work with my clients, I tell them to, one, focus on observing your dog so that you can actually notice subtle changes. For me, it's more behaviorally, with behavioral training, but it's also important, I tell them, to be able to rack up those little wins, because a lot of times people are expecting like this completely dramatic result change, and the reality is you won't end up seeing that until later on, after those cumulative visits have come about. So I love that approach, and I think it's important for people to realize that in a lot of cases, because sometimes we just want things to be fixed, and I think in our society everything is so quick nowadays that we're just looking for those results. So I love that approach. Such a niche topic, and really, really great to be able to share it with everybody. Thank you so much for your time and your expertise. Really great talking with you.
Thank you. You as well, Antonio.
Thank you. Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.